Okay, just a little bit about, I work with a nonprofit group, Small Business Majority, and the reason we're involved in this issue is because a lot of small businesses no longer provide coverage, and that is the recent trend. It's the number one issue when you ask small business, what's the biggest problem facing you? It's healthcare. So that's why we've been working on this for many years, both at state-based reform before it got going nationally, and we see both exchanges and co-ops as mechanisms that provide an avenue to get more choices and more hope for an affordable coverage and better quality coverage that small businesses. So that's our high-level reason for being involved in this issue in the first place. I'm going to backtrack with one off-the-wall topic here. The question's been asked of HHS and Senator Conrad's office, should we be worried about the funding? Has anybody heard what's happening? So I'm going to just give everybody my personal advice. I was a legislator for 10 years. I was in the leadership as Speaker of the House. And I can tell you the people that have the list of the cuts are never going to give it to HHS. They're never going to give it to their staff. I've been in those rooms where you cut the deals and there's a few people in the room. And you don't float those lists around. And that's why it comes out as a zinger at the last minute. Oh my God, something got cut. That wasn't on the list. Yeah. So everything's up for grabs. Everything's vulnerable. So no one should think because they haven't heard a rumor, it's not in Politico or the Washington Post, that this line item isn't vulnerable, because it may be. And so we should all use our best connections to anybody that's in the leadership of the House and the Senate and the White House. We don't need to bother HHS because they're not going to tell them, because if they knew, then they would be protecting the programs, and so would Defense, and so would Social Security, and so would everybody. That's why they're not going to tell anybody at that level. So anyway, enough of that. My presentation in responding to what Alan laid out as the challenges is not going to be based on my work on the advisory board, but work that's been funded here by the Commonwealth Fund, and Roger Neese here and Mike Mendelovitz and I have been doing a lot of interviews as part of this project. So you're all going to think, wow, yeah, I was thinking that. So, well, that's because you talked to us. I think we've done over 60 interviews, and it keeps growing. We've lost count. But we interviewed a lot of you that are involved in forming, and a lot of people in health systems and physicians and other, quote, experts out there, and as well as, studying different models out there, and trying to pull all this together. And then we're going to soon be publishing that. So a lot of my remarks are pulling out of all that research and playing back what all of you are saying and doing, as well as ideas from others there as to how can these challenges and risks that Alan so ably listed. That's our goals there, and we hope this information will be helpful not only to policymakers, but all of you cranking up the co-ops and others out there that we've especially encountered. There's a lot of people thinking about it, and I think a lot of them are waiting, the regs are out, the funding announcement, so there'll be more people looking at it, and they are not nearly as advanced as all of you. They haven't been looking at it for months, and so we hope that this will be a good background for them. So timing, well, I'm an optimist. I started my first business when I was in college because I needed the money to go to college. Well, and anyway, they tell you can't do that, but anyway, that's why we all start things up, because people tell us we can't do things. So timing, well, timing is short. December 7th, 1941, day of infamy. Less than 4 years later, the war was over. Less than 4 years, add it up. You start 42, 43, 44, and the victory, VE, VJ Day were in that spring and summer of 45. Less than 4 years, and the country wasn't, went full mobilization. So people are telling you, this is going to be, yes, it is daunting. There are a lot of risks and challenges, but I don't doubt for a minute that it can be done if what this country did and what humans have done all along. So, and here are some of the ideas out there, and a lot of this has been talked about today. What are the assets and strengths that you can try to gather around you to compensate for this short timetable? Strong partners, get those people on the board. A good business plan, and then, what they say about a good business plan, then you throw it in the trash can, right? But it's very important. I'm a big believer in that, and I know everybody's going to work on it, and HHS is going to ask for it, and it's a necessary part to get up and running and be successful. And getting the right people on the board, you need some startup people. People are talking about that. I think that's very wise. And some of the lists I've seen, people are gathering the right kind of people to help them make those decisions to hire the right kind of staff. And again, drawing from the experience of those partners. I think it's been said too that a lot of people are getting out there in the community and just telling people about their co-ops and having meetings and getting the word out. I think this is part of the business plan and going out there. And so one of the other things talked here today a lot about was the contracting versus in-house service. What's the right balance? How do you vet? Well, this is obviously going to be one of the key things that we've all done in startups. You couldn't do it all in-house. And so it is kind of tricky, but I think this is an important topic that was talked about in the Nashco subcommittee can play in this role. Finding new finances, local foundations, yep, that's good. Reach out to them. And I think the numbers that were cited here today that some of the groups, they've gotten more out of the pro bono and donations and the strategic alliances. We've heard from the employer organizations, from the safety net health providers. They've got experience and resources too there. And in terms of providers, learned a little bit from Michael Permenko, who was on our board, and interviewed him about the history and read up a little about how Rocky Mountain Health Plans had gotten off the private. And I think that's a good sort of case study for everybody to look at and give you ideas about what was the role of providers in getting what is now viewed as a very successful health plan that looks a lot like what everybody's been talking about here today there. But in the end, I think there is still everybody's saying we need more, especially in the long-term creative. There's more homework to be done there, so the infrastructure, sourcing the competitive systems. Here, there's ideas we heard about. We're out there on the following up with what Alan's saying, don't build on the legacy, get out there and get the next generation of stuff, electronic health record systems, smart membership cards, different communication systems that are available now that weren't available before. Group health is doing some innovative things with how they have communication between their doctors and patients. I think looking at all those models of the leaders out there. Again, we talked about the contracting opportunities that a purchasing council could do through group efforts. I think it's getting the right people. We face this challenge for getting 50 exchanges up. How many people know how to run exchanges? Not a whole lot. I think that. So this is going to be a challenge, not only getting the board, that startup board, the operational people, and then your management. I think the Montana and Iowa have set a good example by having provider involvement out there. The The other thing is that I think in our interviews out there, there's a lot of conversations available with provider and integrated health systems, that those are doors people need to be knocking on and having the right kind of conversation. I think a lot of the kinds of things that were said here about the kind of health plans people want to build, not going to find everybody wants to be involved in that discussion, but there's a lot of frustration out there in the other side to have those conversations. Think that there's one, I put this link on here, and I guess we'll get this posted there. Down in Arizona, there's Dr. Cortez, was a retired CEO of Mayo. He's now with the Health Transformation Institute, and I'd recommend you look at their website and what they're doing, because they have a bunch of projects with provider and health systems that are saying the same things have been said here today, that these are projects involved with health systems that want to change, and they're working towards change. And so figuring out if any of those are in your area. But it does say that there are organizations out there that are on the delivery side that you can get some kind of relationship with it and be part of helping you build that winning team. The competition, I think we all know that that's a real tough part of it, and we have all this variation. I've certainly, every time I've gone to a state and learned more about it, I'm sort of really just hit with it, how different it is, and that you really can't assume anything. So obviously you got to understand that. The fact that you're all working at the local level, I think, is a good first start. I think you definitely need to get out there and be working with the decision makers on your exchange. That is good advice, because those exchanges are all going to be really different. And so you got to make sure that it's going to work. It doesn't place your co-op at a disadvantage. So that's going to have to be worked out there. Lots of people are working strategies around different affinity groups. I think that can be one of the counterplays to the marketing challenge of these giant dominant players that have all of these other advantages. And other organizations provide other benefits to their members. So that may be another avenue of gaining members, keeping members, loyalty. The brand, it's been suggested that that you sell yourselves as the community health plan. That is a differentiator. Why are they joining you? Because you're the community health plan. You're not Wall Street's health plan, right? That somebody else's health plan. I think that does make a difference to a lot of people, and emphasizing who you are, and who's in your organization, who's running your organization, who your members are. I think all startups are like that. One of the toughest things out there is to get the first investor, right? And I think everything is like that. People are looking for some signal that's okay. Why should they leave the status quo? And so I think in your branding, you've got to bring these things out, these ideas that people are talking about, I think, are one of the things that can be an asset.